So, hello. Today we will have a discussion about the evolution of the humanity and genetic evolution in each geographic area. And today, to speak about this topic, we receive Dr. Ophelia Dadzi, coming from London. If you want to introduce yourself.
Yes, so my name is Dr. Ophelia Dadzi. I'm a consultant dermatologist. I work within the government hospital, which we say the National Health Service, and also in private practice.
Okay, and Dr. Rim Ben-Musli, coming from Tunis.
Yeah, I'm a dermatologist too, invested in lasers since about 10 years. I'm a founder member of the Tunisian Laser Group, and I work in Tunis.
Okay, so what we will discuss about is since the origin of humanity, we know that Homo sapiens just migrated since 100,000 years or 200,000 years, and after the humanity has been spread around the world on each continent, and we can see that the phenotype of people depends of their origin. And the question is, what about the evolution of this reality? So what do you think?
So yes, indeed, if you look at the human evolution, for many millions of years, really, humanity was based in Africa. And it's a small founder population which then migrated out of Africa. So I think it's really important that when we talk about phenotype, ethnicity, we actually look at geographic ancestry. But I think we need to move away from just looking at phenotype and really support it with genetic testing, which is now becoming increasingly available. So I think that's sort of the initial steps forward. We need to also understand that even with the migration, there's then ongoing lots of intermarriages as well. Mm-hmm. So we have to be very careful when we even talk about, let's say, African skin or Asian skin, because there's a lot of admixing. When you also look at the colonial history as well of Africa, you have a lot of Europeans coming there. So there isn't really one specific phenotype that you can just define for one specific region.
Mm-hmm. Yes, I think the thing is the physical appearance of people is not the whole entire of the genetic. Yeah. So it's only a part of it.
Yes, it is not the only determinant of how you will care about your patient, especially with lasers. We have to take into account not only the color of the skin, but also the genetic. What about the grandparents, the parents? It is a special way to look to our patients, to give them better results with no adverse events, no scarring, no risks. That's what we are supposed to do with the great care to make lasers for anti-aging, for acne scars, for photoepilation, for lightening the skin without downtime, without side effects.
Absolutely, and that's, I think, one of the mistakes that we sometimes do when we use things such as just Fitzpatrick and we look at someone's skin type. And very often, Fitzpatrick was actually not developed for non-Europeans. It was really added on as an afterthought, as it were. So you look at somebody and you just look at their skin type and say, well, you've got dark skin, so you must be type 5 or type 6. That's actually wrong. You need to sit there and actually find out a little bit about their genetic backgrounds. Mm-hmm. I have patients who have mixed ancestry, half Nigerian, half British, and they may look quite fair. You may think, well, they are going to respond adequately to your treatment, but actually you do laser and they may be at risk for hyperpigmentation and scarring. So we do need to take the time and think about that. So that's very important, and not just rely on phenotype.
Mm-hmm. And the question is, in this mixing, this evolution, genetic evolution of the humanity, it appears that it goes very fast. Because if you look on the entire humanity, for millions years, we had the same pool of genetics together. We all were living in Africa before the migration. So it seems to be for now, it seems to the evolution to be very speed, very quickly. People are mixing very quickly and people are thinking that in around several decades, everybody will be darker and everybody seems to be very quickly.
Yes.
And when you say, okay, if I had a patient and I just have to look, okay, even if he's fair, I will look at his parents, but what about the grandparents and
Yes.
how many generations you have to look? So it doesn't make any sense to judge people about their appearance.
Yes.
And moreover, probably we know that the appearance is nothing in the whole genetics of people. I think I just remember. I think it's less than 500% of a DNA is about phenotypes.
Exactly.
So probably we have to look. But the question is, how long and how many generations
Yes.
before?
I think that ultimately, we are going to have to develop technology whereby we can actually undertake tests, genetic testing, because though we say that there is a lot of admixing and there's been migration, if you look at human genes, it's very much conserved. So you compare a mouse gene and a human gene, there's a lot of similarities. And the differences that we're seeing may be accounted by actually 1% or 2% differences when you look at the actual genetics. So we've seen a lot of phenotypic differences, but actually in the great scheme of things, there's a lot of similarities. And I think the technologies are being developed and will be, whereby you can actually not just rely on phenotype or clinical history, but we can start trying to be a little bit more scientific about it and actually trying to do some genetic analysis. At the moment, you can do whole genome sequencing. You can take people's blood and sequence a whole genome. So I can foresee that in the future, that is really where we need to be looking at. And that means that we don't need to just stop by saying who's a grandparent, parent. We can actually have something a little bit more scientific.
I think that Rim just faced with her patient on a lot of mixing people, a lot of diversity.
Yes, that's what we assist to these years. We have a mixture of skin phototypes but we have also some population with more tanned skin. So we have to care about that, especially when we work in Tunis, because it is a sunny country. So we have to taste also the propensity of the skin to tan. We have sun all over the year, and even in winter. So we have to carefully manage.
To go there. Sounds good.
Carefully to manage about that and to care about the education of the patient when dealing with lasers to those skins. Not only because of genetics, but also because of the environment.
Yes.
They are living in a sunny country, so they have to be prepared to their laser treatment before, during the session with mild parameters, sessions, leaving time to the skin to heal and to fade, and then post-procedural cautions.
And
That's important.
I think that's very important, because although we are talking about genetics, we need to also understand that cultural factors are relevant as well, and the impact how people behave, as you've just said. So cultural factors, even about using sunscreen, that's relevant for my patient population in the UK, where they think, well, I have dark skin, I don't need to use sunscreen. So as well as the genetic side is important, but we mustn't forget that there are also cultural factors, which is exactly as you said, it's based on your environment, social factors.
Yes,
That's
because
also
genetically
pertinent.
you have the question of the migration of people, but also the culture.
Exactly.
I mean, if someone has black skin, but with the African culture, he will treat the skin very differently than someone black but living in a European country since his birth.
Exactly.
So this is very important to talk about. I just wonder if we could have the same discussion in 100 years. Maybe we will think that the gold standard with laser will be to really take care of hyperpigmentation, because even someone who will look very white and fair will probably have some different and mixing origins. Yeah. So maybe this discussion about the specificity of dark skin will probably be for the majority of people in the future. Yeah. So that's why we have to really take care and to explore those special skins, because in fact they are not special. They are the majority on Earth.
Yeah. Exactly, and that's exactly it, because you look at also the data from the UN population forecast. By 2050, the only majority country which will have a majority population of Europeans will be Russia. So you're talking, this is actually going to be the norm, rather than something which is, you know, a bit special, exactly as you said. So we do have to start understanding and appreciating this.
Yes, and you are practicing in London, but imagine for Rim, she's just faced every day. This is normal patients, like phototype 4. So, and we are just organized a congress about those special skin, but everybody, a lot of dermatologists are faced to these patients.
So. And we have to consider also some social attitudes. For example, in my country, for example, or in North African patients, when they clean up their skin, they have a tendency to rub the skin. So, moreover, skin phototype, color of the eyes, propensity to tan, grandparents, parents, phototype, we have to consider also some social comportments and attitudes that will maybe aggravate by scratching the skin, and we have to consider that. Yes, about not to rub the skin, not the scratch, the crust, maybe to enhance our treatment.
Exactly.
So mixing is a question of genetics, but also culture. Education, and but with the future communication in between each country and migration, probably we will have the very gold standard for the world population.
Exactly.
So thank you.
Thank you.